Hello everyone, welcome back. I'm Dr. Swati, I'm a periodontist, and this video I'm going to talk on a topic that has become a very hot topic, I can say, during the pandemic, and something that we all should be aware of: mental illness and the role of dental professionals in diagnosing mental illness. If you like this video, please like, subscribe, and also share, and hit the notification bells and keep me updated with my upcoming videos. So, why am I talking on this topic? Why is it so important? Recently, you would have heard in the news or in newspapers, or even like professionals, medical professionals are talking about how mental illness is going so much undiagnosed, and how much there is a rise in the number of cases like anxiety, depression. People are getting more, having some mental issues. So I think as dentists, as specialists, we should be able to at least diagnose the patient, if not treat, which we cannot, which has to be, and they should be referred to special medical professional for that, right? So what is about mental illness that we should be aware of? Usually what you read is how people with mental illness or the mental issues, the kind of medications they are on, and how that affects the oral cavity. But rarely we talk about what are the signs that we can actually notice in a patient, and we can help in identifying mental illness and referring them to someone. When I was doing my periodontics residency, we were taught about oral systemic relationship. That's a part of periodontics, right? And I think all of us, regardless of our specialities, we should be aware of oral systemic relationship, because that's very important. When you're in a clinical practice, you should be able to diagnose your patients if they have any kind of systemic disease which they are unaware of. So oral systemic relationship is not only restricted to periodontics, but I think everyone should make an effort to understand that. Now, mental illness was also discussed, but only, like I said, in terms of how the medications affect the oral cavity and what you can see in oral cavity, right? So I ended up doing a study. I did a short-term study with my education in Manipal, and I ended up doing a short-term study where I went to an institutionalized center where schizophrenic patients were being treated. And what I was trying to do was, are there any clinical signs that are not a side effect of the medication or something like habitual? And I did a 6-month study. I ended up writing this review paper that you see on your screen. It was published in Nepal J Epidemiology, and I'll put a link for this article if you want to read about it. So what you see is what we usually read. Yes, they have gingivitis, they have most of cases of periodontitis, most of them are partially edentulous. But what I found out from there was that in certain patients, like at least 20-35%, it actually even goes undiagnosed. And certain habits like nail biting, certain conditions, you can actually see in the oral cavity that can point out towards that, oh, these patients might be having some mental issue. Okay, not necessarily schizophrenia, but any mental illness. And I'll be coming to that about different kinds of mental illnesses. But since it's a short video, this is just to make you aware so that you can implement this kind of awareness in your clinical practice. Now, before I even go ahead with what we can see, I want to talk about what is mental illness and what is mental illness to you. Now, usually people are very hesitant to talk about mental illness. And when we even mention the word mental illness, the first thing that comes to someone's mind is maybe the person is mad, or bipolar, or schizophrenia, or dissociative disorders. But we never think about depression, anxiety. And when we think about depression also, we think about literally a very grave situation of depression. But there are certain illnesses which are not that grave, and they are mental illness. So mental illness are health conditions that involve changes in emotion, thinking, or a behavior, or a combination of these. And these are associated with distress, and or problems functioning in social, work, or family activities. It's on your screen, and this is given by American Psychiatric Association. So there could be anything. It could be anything that interferes with your daily activities, and it could be anything that involves changes in emotion, or thinking, or a behavior. So it can be as tiny as like a bulimia, or anxiety, or your addictions, right? These are all mental illnesses, and these are not necessarily associated with making a person completely out of control and not treatable. So you can help and contribute in diagnosing these mental illnesses, at least in your patients. So this I found from this health statistics. You can even go to this. I'll be providing a link for the statistics of the mental illness, and you can go to that site and read more about what different kind of mental illnesses are there if you're interested. Let's go to something else which I found when I was doing my research. If you see, this was by organization naco.org. You can go to that. So it says 1 in 5 adults experience mental illness in a year. More than 47 million people live in places where it is difficult to access dental care. More than 125 health conditions affect or are affected by oral health, which includes rheumatoid arthritis, mental illness, obesity. Between 2008 and 2010, more than 4 million people visited emergency department, and severe mental illness cost the US $300 billion each year. Another important fact by the US surgeon was by 2020, mental illness and substance use disorder will surpass all physical disease as a major cause of disability worldwide. The side effects of antipsychotics, antidepressants, reduce the flow of saliva, results in cavities, gingivitis, periodontal disease. By addressing oral health needs of individuals living in mental illness, we could potentially reduce the patient's risk for heart disease, leading cause of death in the US. So yes, this relation is very much clear in our minds because we read so much about it that they have people with mental illness, their medications are causing so many issues. And that is one thing, that they do not get the required dental health care because half of them are in areas where there is no dentist. So we have to increase, we have to increase our reach for these patients, try to work with institutions where we can extend our help and try to rehabilitate patients. Now, there was few studies that I found that I'm talking to you about, that a Kenrad group in Denmark, 2016, they found a correlation with morphology and eruption location of permanent maxillary incisors, cleft palate, cleft lip, and mental retardation. There's probably, we've read a lot about how cleft lip and palate patients can have certain kind of mental retardations. Increased tooth loss is very common in patients with anxiety, depressions, and phobia. And 40% of patients with mental illness have substance abuse disorder. Another study in 2011 says 3.4 times higher probability in psychiatric population to be edentulous. So you see that patients with mental illness, if they keep going undiagnosed, they're just having a bad oral health. They're just losing teeth, they're becoming edentulous, and patients with bad oral health are more prone to have some kind of illness also. So it's an interrelationship. In this interrelationship, we are very much clear about only one part about, yes, the medications cause this, but we have to be very aware of how we can help diagnose a mental illness as dental professionals. And coming to that, if you see, I made a chart of few early signs and symptoms, and I have taken this from different studies and different articles. So common behavioral changes that you can look for in your patients who've been coming to you for a long period of time. You can probably look for changes. If anything is occurring, you can be perceptive and receptive of that. Symptoms like loss of appetite, lack of interest, insomnia, any kind of eating disorder that the patient tells you about, anorexia or bulimia, substance abuse. Now these symptoms are something that behavioral changes are something that you can actually see in your patient. If a patient is a substance abuse, is using a lot of, is having problems like anorexia or bulimia, is showing lack of interest and he's been coming to you over a period of time, I'm not saying to leave your duty of as a dentist and jump into a role of a counselor or a psychologist. But yes, you can actually be the person who can little bit maybe diagnose, maybe counsel a bit, and then refer them to a specialist, to the person who's certified to counsel them, who's certified to help them, right? But if we do not step out of our duties just as a dentist or as a specialist or a periodontist and just deal with the oral cavity, we will never be able to even look at the other signs which are staring at us right in our face, right? The common oral signs that you can see: poor oral hygiene, very poor oral hygiene I must say, xerostomia, rampant caries, TMJ pain, candidiasis, burning mouth syndrome, bruxism, very common sign, erosion, high DMFT index, abnormalities. Now you won't see all of these, and sometimes all of these, sometimes one of these symptoms might be even present physiologically. But when you see that, I think you should, again which I'm stressing on, you should step out of your comfort zone as a dentist and try to see if there's anything related to it. Now to tell you, I had a patient and she was complaining of TMJ pain, and they were always, they couldn't figure out in our oral department, periodont and radiology, there's nothing wrong here, but there was something wrong here, and the dentist was like, okay, there's nothing wrong with you, and okay, fine, you know what, we can't diagnose anything, you should go to, and she'd gone to so many dentists. Eventually, she had come back, and then we tried to talk to her. We figured there were some issues in her personal life that was causing her so much pain, and then we referred her to the Department of Psychiatry for some kind of counseling. So this is what I'm talking about. Yes, in your clinical practice, you might not have enough time to really spend so much time with one patient, but maybe 2-3 extra minutes of your time in each patient, just trying to figure out if they have any systemic disease which they are not aware of, or if you see any of these signs like too much bruxism, or patient is highly anxious when they come to you, or the behavior is changing on frequent visits, and their history talks about maybe some kind of disorders of substance abuse, you can play a role and help to diagnose and then refer them to a psychiatric facility or a counselor, not directly psychiatric, but a counselor or someone who can help them. Okay, I hope that I put my message across in this video, that please do not limit yourself to doing dentistry, to being a periodontist or oral radiologist, but you can help these patients by extending your services to institutional facilities, and helping these patients and rehabilitation, and at the same time in diagnosing, and also creating an awareness amongst everyone that mental illness, talking about mental illness should not be a problem. Mental illness is not a grave disease. It's something like how we talk about gastritis or heart disease or obesity. It's same. Okay, it's not any different. It should not be a taboo to talk about if someone is going through any kind of anxiety, depression, OCD, or anything, and they should be made comfortable to talk about it. In the end of my video, I'll be putting link to all the sources that you see on the screen right now. If interested, please go through it, and I hope you can incorporate these tiny habits in your own practice and help everyone around you. Until next time, have a good day, Happy New Year, and I'll see you next again.